Welcome to Doctor Study tutorial. Our today's topic is epidemiology of periodontal disease. So let's start it. The periodontium defined as those tissues supporting and investing the tooth comprises of cementum, periodontal ligament, alveolar bone, dentogingival junction. Then we have to know what is epidemiology. Epi means upon, demos means people, ology means science, epidemiology the science which deals with what fall upon people. So, epidemiology has been defined by the John M. Last in 1988 as the study of the distribution and determinant of health-related state or event in specified population and the application of the study to control the health problems. A very important written and viva question is classification of epidemiology. It can be classified into two types, observational study and experimental or intervention. In observational study, it can be divided into descriptive study, analytic study. Analytical studies are divided into ecological or correlational, cross-section or prevalence, case control or case reference, cohort or follow-up, and the experimental or intervention is divided into randomized control trial or clinical trial, field trial, community trial or community intervention studies. Another important question is what is periodontal disease? Periodontal disease is a term which include all the pathological condition of the periodontium, gingiva, alveolar bone, cementum and periodontal ligament. These are the elements of periodontium. Traditionally, periodontal diseases are classified into gingival disease and periodontal disease. Here is the picture of a healthy teeth and periodontitis. Epidemiological triad consists of host factor, agent factor and environmental factors. In case of host factor, it is consist of age, more than older age, greater than 40 years, sex more in males, race black are more affected than the whites. Intraoral variation, gingivitis is more seen on the intraproximal area than the buccal or lingual area. Severity of the bone loss, incisor and molar area are more severely involved than the canine and premolar. Maxillary teeth experience more bone loss compared to the mandible. Endocrine changes. Changes are more in puberty, menstruation and pregnancy, hyperthyroidism and hyperparathyroidism. Traumatic occlusion. Sharp cuts act as a plungers and lead to periodontitis. Tooth position. Irregular alignment causes unclear area which causes pocket formation. Occupational habits. Thread bite, holding nails between the teeth, etc. Neurosis, bruxism, lip, cheek and nail biting, use of tobacco, component present in the tobacco lower than the tissue resistance. Misuse of toothbrush, concomitant disease, there is a tendency towards alveolar bone destruction in the patient with uncontrolled diabetes. Income, periodontal disease increases with the decrease in income. Education, periodontal ligament disease and education is also inversely related. These all are the host factor. Then the next one is agent factors, which consist of plaque and calculus. Dental plaque, primary etiologic factor for periodontal ligament disease. It is defined as a soft deposit that forms the biofilm adhering to the tooth surface or other hard surface in the oral cavity, including removal and the fixed denture. Distribution of a balance between plaque bacteria and the host result in periodontal ligament disease. Dental plaque is divided into supragingival and subgingival plaque. Here is the picture of supragingival plaque and subgingival plaque. Marginal plaque responsible for gingivitis, supragingival, and the tooth-associated subgingival plaque for calculus, and the root carries tissue-associated subgingival plaque for periodontitis. 1 gram of plaque consists of 2 into 10 to the power 11 bacteria. It is a very important MCQ as well as viva question. It also contains epithelial cell and the macrophage embedded in the organic and inorganic matrix. Organic and inorganic material are divided from the bacterial product. Accumulation of the plaque is found to be more on gingival 1/3 of the tooth surface, crack, pit and fissures, overhanging restoration around the malaligned tooth. The rate of formation and location vary according to the oral hygiene practices, diet, saliva composition and the rate of flow. The next agent factor is dental calculus. Calculus is an adherent calcified mass that formed on the surface of the natural teeth and the dental prosthesis. It consists of mineralized plaque. Calculus would be divided into subgingival and supragingival calculus. Then we have to know about the supragingival and subgingival calculus. In case of supragingival calculus, it is white or whitish yellow in color. It is found to be maximum in the upper first molar, followed by the lower central and lateral, and least in the upper anterior. It can be easily detached. In case of subgingival calculus, it is dark brown or greenish black in color. It is found to be maximum in the lower central and lateral, and followed by the upper first molar, upper anterior and upper second molar. It found to be least in lower first and second premolar and lower third molar. Here is the picture of supragingival calculus and subgingival calculus. The last one is environmental factor. It is consist of geographic variation high in Chile, Jordan, India, Malaysia, Ceylon, intermediate in the USA, Black, Colombia, Ethiopia, Ecuador, and low in the USA, white, dentist deprived areas. Nutrition high in niacin deficiency and a vitaminosis C. International Committee on Nutrition for the National Defense said that there is no consistent association between the periodontal disease and nutrition items. Severity of the periodontal disease are found in the area with protein energy malnutrition and the vitamin A deficiency. Degree of urbanization, rural people seems to suffer more from the periodontal disease compared to the urban people. Stress. Stresses is said to predispose to anag and is often seen in the exam going student. Conclusion: periodontal disease account for a majority of missing tooth in adult and result in tremendous economic and social burdens both to the individual and the society. Periodontal disease is so prevalent that the only possible solution is prevention. That's all. Thanks for watching.